welcome to Digital Health Talks, the podcast for healthcare changemakers focused on fixing healthcare. I am your host, Megan Antonelli, and today we are exploring real healthcare transformation with Steffany Whiting, EVP of Marketing at iMethods. Hi, Steffany. How are you today?
Megan, thank you so much for having me. I'm excited to be on your podcast. This is the
I'm
first.
so excited. Yes, it's so funny that you haven't actually been on.
I know.
And I know we have a big event coming up. The healthcare leaders are going to be coming to Philadelphia for the September 24th and 26th iMethods Leadership Summit. And I know you're partnered with Christiana Care, and it's going to be at the Logan Philadelphia Hotel. So I am so excited for the event. I can't believe how great the agenda is, having attended last year's summit in New Orleans. It's just been such a great program to be involved in. I know you guys at the team does so much work to make sure that, it is really a gathering of healthcare systems. So it's so aligned with what we do here at Health Impact. So it's always very exciting for us to partner with you on it. So before we get into that and the theme and all of that, just tell everybody a little bit about you and what you do at iMethods and kind of, your transformation journey.
Well, it's been interesting. So I didn't start my career in healthcare at all, like many of us, right? We did something else first. And so I've been in healthcare for about 25-ish years. I'm going to not put a number bigger than that on it.
And now, how possibly did you not start in healthcare?
I was only, yeah, exactly. It's been a long ride, but it's been interesting. So I've been able to have the great, good fortune of working in lots of different aspects of the business. I was with an MSO in the early days that did back office operations for academic medical centers. I've worked for large physician practices. I've worked for hospitals. I've worked for technology companies and radiology. And so at iMethods, as EVP of Marketing, I am able to apply that sort of holistic view of healthcare to our consulting and solutions business and help the company grow in that way. There is no shortage of technology needs right now. Things are moving at a breakneck pace, and we're trying to help our clients keep up. But it's really been a fun ride. I have to say, I have dabbled in the land of PACS and risk system design, and I've had product management experience and worked in population health and value-based care. So really just seeing everything sort of come together. I say it all the time, but healthcare is not boring, and it's not boring now more than ever. So very excited to be part of the business because I think that we have just so much opportunity, and I choose to look at it that way. Not so many challenges, that we have lots to do.
Yeah, it is. There's no shortage of things to do for sure. And I think, as you said, over the last 25 years, I feel like there's, healthcare is kind of caught between two realities, right? We're either stuck and not changing fast enough or changing so fast that it's impossible to keep pace. So, when you have these convenings of folks, I think with your theme this year around declaration of transformation, there is this understanding that it's time for change, that there's change happening. There's not only the tools to make it happen, but the will and the way, right? So tell us a little bit about that and how you guys came to that, and what you think is kind of driving that urgency around transformation.
Sure. Well, I'll talk a little bit about how we got to the name, because that's always fun. So every summit, you came last year, it was jazzing up healthcare. We always try to bring in a little element of the local vibe of the host city. And so with Christiana Care hosting with us in Philadelphia, we felt like we needed to embrace the patriotic vibe of the Philly area. And so the Declaration of Transformation just felt right. Christiana Care is doing some pretty big transformational work, and it's an opportunity for all of our innovative partners to come together and discuss what they're working on. So yes, there's the urgency and the level of stuckness that folks find themselves sort of in between. On the one hand, we're going to talk about AI this whole podcast. That's just it's infiltrating every aspect of everything we all do, including us in marketing, right? We're all working with so much AI. But what I'm finding and where we sit in the business is that health systems and certainly IT departments are moving. They're not slowing down, but they're moving with greater purpose and strategy sort of lens. So rather than chasing every bright shiny object, they're really focusing on what value does it bring? What is the total cost of ownership of something? What's the real total value that it's going to bring to my system, to my providers, to my stakeholders, to the bottom line? So there's a lot of outside factors factors. There's the technology, stuff moving so quickly. There are always financial constraints. They were bad before COVID. They're worse after COVID. Now we have new regulatory issues that may be driving some operational changes. Probably a lot of M&A activity we're going to see in the coming years as a result. So really looking with the near term and the long term view all the time is what I'm seeing healthcare IT leaders, well, healthcare leaders more broadly, really focusing on, so that they're not so stuck. They have an eye on the future with the need for innovation. They're not slowing down the innovation. They're just doing it in a more strategic way, so that they're impacting their organization and the patients they serve in ways that are most meaningful to them. Workforce issues are a big one. Do we have enough nurses? No. Do we have burned out nurses that are working? Yes. Doctors are overburdened. So all these different elements of the business need to be accounted for, and technology can solve for a lot of it, but not all of it.
Yeah, for sure. And you mentioned kind of that diverse health system leadership, and it's not just IT leaders, but it's that sort of title or that responsibility has changed so much. And I think what struck me last year was that it wasn't just CIOs, there were the CNIOs, many CISOs, and that conversation between those health system leaders was so important. And I think that, when you look at kind of that value, when you try to create this event and kind of bring those together, the common pain points for those folks sitting in that, in those roles within the health system, what are some of the most common that are coming through?
All the things I just said, really. I mean, they sit in different seats in the organization. They have, different responsibilities, but they are all facing financial pressure. They are all facing workforce challenges. They are all facing how to implement technologies that are going to help them do their jobs better, and balancing it, like we were talking about at the top. But really capturing those unique perspectives. I found that last year at the conference was the first time we had a mixed C-suite panel versus just CIOs. And it was such an interesting dynamic between them, because they really do work together, and most healthy health systems do that. They all collaborate very closely, and having those different vantage points and different perspectives represented on a single conversation really drives that home. In fact, at this summit, Christiana Care's CISO and CIO are going to be in a fireside chat discussion where they're just going to talk about how they work together and how their relationship has to be so sort of symbiotic in some respects to make sure that what the CISO needs, the CIO knows that they are able to, collaborate, because they're intertwined in a way that we've never seen before. And that's, so I'm looking forward to that presentation for sure. That's going to be a fun discussion.
100%. I mean, and, I think, you mentioned sort of that shift from the shiny object syndrome to now really making more purposeful and meaningful, investments. And, certainly at the event, there's going to be a lot of discussion about it, but throughout the year, at iMethods, you're seeing that. What are some of the, things that people are shifting their attention to, or maybe even more interesting, things that people are saying, that was a bit of an expensive distraction, right?
Yeah. Well, I hear a lot about, more than ever, because of the financial constraints, saving money is making money. So if you are doing some pretty purposeful application rationalization, that's a major initiative that we're hearing a lot about. It's just that there's a lot of technology sitting on shelves that are costing health systems money that are not bringing value or not being used. They were a previous era's bright shiny object, and the new bright shiny objects are largely AI related. There are plethora, thousands and thousands of AI applications, and everything does something magnificent. But with those cool innovations they might bring, they also carry a lot of risk with them. They bring their own security problems. They bring all these other things. So what I've heard a lot from our partners is that really identifying a problem rather than solving a problem, and then or finding a product and then go finding the problem it solves. Like, know what your problems are. Really be intentional about focusing on solving the issue at hand and at scale if possible, so you're getting the most value from it. But have a well understood problem before you move into buying new things and then unloading the stuff you're not using. Take the time. That is a huge savings. And we've had health system partners who drop their tech stack from 60 something plus active applications down to the teens over the course of a year or two, just because it was either wasteful or duplicative. And I mean, that's honestly a lesson for everyone, right? We could all be a little bit more intelligent about how we manage our technology stack.
Yeah, no, totally. I mean, it makes me think about all the subscriptions that are likely lying in my various
Right.
uses, right? I
Well,
mean,
yeah,
it's
for
become
sure.
hard to manage, I mean, sort of like I was always an inbox zero person. I can't even get to that anymore, and let
Yeah.
alone all of the other, various things that are,
Yeah.
kind of difficult to do. And when you're running an organization of the scale and size of a healthcare system with so many different departments and so many different divisions, how much of an undertaking it is. But of course, how much savings there is when you do
Right.
shift that focus.
Well, the
Um,
governance is so key, for sure. But then, they can't slow down. They can't stop upgrading their implementations of their EHR. They can't stop optimizing it. We have a lot of folks that are going to be moving to a new PACS or a new ERP system because they've hit their 15 to 20-year life cycle and it's time to get something more modern. So these things are still moving forward. They're just moving forward with, a deep sense of understanding of the problems they're solving, and nobody's just taking the easiest path. They're taking a very thoughtful and and sometimes slightly longer time to make these decisions so that they don't have to do it again anytime soon.
right. Yeah, no, absolutely. And of course, and you mentioned the CISO of Christiana Care participating. You have a number of other CISOs that are there. Security continues to be, such a high priority. While in the past, maybe it was a little bit, it was less so, sort of an afterthought. But now, particularly, I think with these added AI initiatives and cloud and all of that, that there's a big focus on that. Where are you seeing some of that, with your customers and the folks come in?
Yeah, well, it's interesting. This is the first time we've had a CISO be our key point of contact at one of our summit hosts, and she's amazing. I don't know if you know Anahi Santiago. She's amazing and has been such a great partner through it. And really, she's helped us frame our summit differently. And as you mentioned, we have a lot of cybersecurity or security involvement in the agenda. So what I'm finding is so interesting is conversations with the CISOs that we're bringing to the meeting. So what I hear consistently is that if you're reacting to something, it's too late. You've already lost. You have to be outside of the box, ahead of the problem, being proactive. I mean, AI has a role in that in terms of staying ahead of the bad actors who, oh, by the way, also have AI. So there's that dynamic. But I'm also hearing a lot about the risks of physical security issues. So we're all hung up on the technology, but that's not even really necessarily your worst threat area. That's where potentially people are trying to hack in. But the physical security of health systems, badges, monitoring open doors, things that open risk, and once someone's inside your firewall, they can do a lot of damage. So the physical aspect of the security challenges, and then at the end of the day, down is down. If a health system is offline for whatever reason, it's a cybersecurity attack, ransomware, something happens from within the health system, or there's a natural disaster. There needs to be a plan for responding, but trying to mitigate any, problems where you can, but you can't solve for everything. I live in North Carolina, as you know, and not far east of where Helene came through last year about this time. And, it was catastrophic to the health systems there. And so you can plan for what you can plan for. You can have offsite, backup data storage and all these different things. But at the end of the day, these CISOs carry a much heavier burden than they did in the past because their scope of their responsibilities has expanded.
Right. Absolutely. I mean, that threat is, it's everywhere, both from the disaster side to sort of that keep things up and running. But you mentioned Anahi, she's a favorite of mine. One is a female CISO,
Correct. Yeah.
which there are not that many, but she's also an incredible Philadelphia ambassador, right? Huge sports fan.
Gosh, yes.
I love it.
Go Eagles, right? Go Birds.
Yeah, go Eagles. What a perfect time as the NFL is just approaching as well. So how fun to kind of be in Philly with her at this time. So, but also the Women's Leadership Summit that you guys have as part of that. I still remember sitting in that room with everyone, and it was just, sometimes you go to those and it's a little bit like forced or not we're all talking about women, but these problems sort of resolve, or reside in every department. It doesn't matter. But it was really great. And I think part of that was because, one, the senior level of folks that you have there, but also the diversity of their responsibilities that made it just that, it wasn't just a bunch, all CIOs, female CIOs talking. There was a number of different CNIOs and CISOs there. So I know that has expanded and that you're doing more this year. Tell us about that and what you have planned.
So excited. So this whole evolution of our women's thought leadership group sort of grew out of a panel discussion we had 2 years ago in Oklahoma City, and it was standing room only. The engagement from the men in the audience was so heartwarming and adorable. Like, I just couldn't, they just want to help. They just don't know what to do. So this last year we expanded it in New Orleans, where you were, and it was a decent space, right? We had room for about 70 people. We had to turn people away. It was standing room only, which was great and terrible. I hated to cut people out. There's just literally, like, the fire marshal was going to have an issue with us cramming any more people in this room. But to your point, it has evolved into this very meaningful, regular gathering of women leaders who have taken different paths. All of us have taken a different journey to get where we are in this business. And, at the end of the day, only 3% of leadership in healthcare is women. It's very small, 3 to 5%, I guess, but from being generous, but it's very low. And, how do we help each other? How do we engage with help from, men in the organization who want to, and honestly just don't know what to do, to be good partners to us? And so it has evolved into this incredible network of like-minded people who are looking to not only learn from each other, but also mentor each other and be that person to say, this is how I did it. This is my network. I'm happy to introduce you to people. So all those kinds of things, it's really evolved. So this year, because of our learning last year with the rooms being too small, we are dedicating an entire afternoon. So from 12 to 5 p.m. on the first day of the summit is exclusively this Women in IT forum, where we're bringing panelists who have been with our group from the beginning. We have new folks in the room. So we're expecting about 75 to 80 people in this session alone, just to spend the afternoon together talking about, accessing networks, how to navigate a hospital system and leadership, how to talk to people, how to make an impact, and how you can see yourself as uniquely impactful, having a uniquely impactful role in the organization. We have a couple of male speakers, which I love. I think it's fantastic. So we really are have expanded it, and it's just been such a welcome evolution to be a part of. And I give great credit to one of our directors of business development, Mary Beth Ashley, who's just kind of her baby, and it's just sort of grown, but now it's a national program. And we meet at the summit, and then we meet off cycle in the spring and bring all these folks together to share best practices. We're launching a mentor program this year, so we can elevate those in the group. They have a pay it forward model. So once they graduate from the program, we help enable them through best practices and literature and guidance to then launch their own version of it within their organization for the younger women leaders who aspire to grow in their role. So it's really just become quite a movement in a lot of ways. I'm excited about it.
Yeah, it's great. I mean, and it's just so good to see, because I think, obviously we here focus a lot on female leadership and female founders, and women in IT in general. And, HIMSS has been holding their Women in Healthcare IT group for a long time, and it's nice to just see it evolve. It's nice to see it expand, right? It's the sort of inclusion and elevation of nursing in the sort of decision makers of healthcare and health IT, has really changed that discussion to make it meaningful. But you mentioned that there were men in the room and there were male speakers, and the sort of that feeling of sort of having the allies there and the importance of that mentorship was also, really meaningful, I thought, at the event. And
I'm glad you were able to attend it so you could see it firsthand, because it's really kind of a labor of love for all of us, and it's fun to be able to contribute to people's career success and their professional growth.
Yeah. Well, we always end on good things, and I could talk to you all day. So about,
I know. Well, we do talk a lot, actually, but
we want to make the right time for the show on the. We always end with the good things. So we end on a positive note. The Women's Leadership Forum at the conference is definitely a good one. But give me one more thing in terms of when you think about the theme, all right, around the Declaration of Transformation and transforming healthcare. What are some of the, what's one development in healthcare that has you super excited?
That's a tough one. I really struggle with this one. I think the thing that I love most about the summit, if I'll just stop and I'll reboot after that, but what I love most about the summit is the networking, because these are all people who don't know each other, who come together from all over the country, who connect. They have the same problems, so they can benefit from each other. Someone's further along, the trajectory of an issue than another, and they can talk to each other offline and without iMethods. So that's one of the more meaningful takeaways, aside from the content, which is amazing. I think the networking is unparalleled and truly. And I go to a lot of conferences, and I'm going to say that, just from the takeaways and the friendships that are made, it's great. From a technology standpoint, I mentioned early on that I had a background in pop health and value-based care, and I'm a big believer in keeping people from getting sick in the first place so they don't become expensive patients down the line. And one of the things, and this is just post-UGM, that I'm excited about is the evolution of the Cosmos product and Epic's platform. Just the ability to have that much data. So I think it's like 16 billion encounters or some enormous data set that they can anonymize across all of their clients and create clinical decision support ideas and social determinant information and predictive analytics, and really change the way healthcare is delivered and reaches people. That warms my heart. That's not been available in a single platform before, because everything's been so disparate. And to have, Epic, which owns a lot of the market, obviously they're the big, player in the space, but to have that kind of clinical and claims data that can really turn the tide on everything from research to, operation and efficiency. I mean, that kind of stuff. It's very cool. And I'm very excited to see where that goes.
Yeah, I couldn't agree more. I mean, it is kind of the realization or the culmination of what we kind of always said would be possible, right? And once you get all of that information together and you can make those decisions with that technology that's even always been there. But of course, now the technology is so much more powerful. The tools are there. So great thing. And I think, as we close up, just that reiterating the importance of coming together and sharing and kind of, building on, transformation. So thank you so much for joining us. Tell folks how to get in touch, how to register for the Declaration of Transformation, September 24th and 26th in Philly.
Sure. So thank you for having me. So yes, the Declaration of Transformation is in Philadelphia. It actually starts on the 24th at noon, finishes about the same time on Friday. So it's chock full of activities. The event site, you can search Declaration of Transformation online, and it should pull up the event site. And registration is available there. We do have discount codes for provider organizations. So if you want to provide somebody with my contact information as part of the follow-up to this, they can reach out to me, and I'd be happy to give them a discount code to waive their registration fee, because we would love to the more the merrier is how we look at this.
Yes, absolutely. And as that, feel free to reach out to me, always on LinkedIn or through our website here. So we can connect you with Steffany and make sure you get registered, especially the hospital side of that. So awesome. Well, thanks again, Steffany. Such a pleasure. As I said, I could talk to you all day, and I think there's just such great work that you guys do at iMethods, and the community that you're building there with your customers, across the country is great. So
thank you. Thanks again for having me, Megan. Great to see you.
Absolutely. And that's all we have today, folks. Thanks so much for joining us on Digital Health Talks. I'm Megan Antonelli, reminding you that fixing healthcare requires both bold vision and disciplined execution, and gatherings like this to create peer networks where both can thrive. Until next time, keep transforming healthcare.